In this lesson, we're going to review the anatomy of the facial bones before we talk about radiographic positioning. The human head has 14 facial bones: right and left nasal, right and left lacrimal, right and left maxillary, right and left zygomatic, right and left palatine, right and left inferior nasal conchae, a vomer, and a mandible. Nasal bones are composed of two small, thin bones that vary in size and shape in individuals. They form the superior bony wall of the nasal cavity and are commonly called the bridge of the nose. Each articulates with the other in the mid-sagittal plane. Superiorly, the nasal bones articulate with the frontal bone. At the posterior superior edge, they articulate with the perpendicular plate of the ethmoid bone. On each lateral side, they articulate with the maxillae. The lacrimal bones are the two smallest bones in the skull, located in the anterior part of the medial wall of the orbits, between the labyrinth of the ethmoid and the maxilla. Each bone contains a lacrimal foramen through which the tear duct passes. The lacrimal bones articulate with frontal, ethmoid, maxilla, and inferior nasal conchae. The maxillary bones are the largest immovable bones of the face. Each articulates with all other facial bones except for the mandible. They also articulate with the frontal and ethmoid cranial bones and form part of the lateral walls and most of the floor of the nasal cavity. The maxillary bones also form part of the floors of the orbits and 3/4 of the roof of the mouth. Each has a zygomatic process that articulates with the zygoma to form part of the cheek. The maxillary body contains large pyramidal cavities called maxillary sinuses and contain an infraorbital foramen located under each orbit for passage of the infraorbital nerve and artery. Alveolar processes compose the inferior borders of the spongy bone that supports the roots of the teeth. The anterior nasal spine is a forward pointed process at their midline junction, and an important positioning landmark, the acanthion, lies at the midpoint of this junction. The zygomatic bones form the prominence of the cheeks and part of the side walls and floors of the orbits. The temporal process, also called the zygomatic prominence, extends posteriorly to join the zygomatic process of the temporal bone. The zygomatic arch is formed by the union of the temporal process of the zygoma and the zygomatic process of the temporal bone. Superiorly, the zygomatic bones articulate with the frontal bone, while laterally with the zygomatic processes of the temporal bone. Anteriorly, it articulates with the maxilla, and posteriorly with the sphenoid bone. Palatine bones are displayed in purple on this slide and are composed of two L-shaped bones with vertical and horizontal plates. The horizontal plates articulate with maxillae to complete the posterior fourth of the bony palate, or the roof of the mouth. Vertical portions extend upward between the maxillae and pterygoid processes of the sphenoid and the posterior nasal cavity. The superior tips of the palatine bones assist in forming the posterior-medial orbit. The inferior nasal conchae extend diagonally and inferiorly from the lateral walls of the nasal cavity at its lower third. The nasal conchae are long, narrow, and very thin bones with a lateral curl that have a scroll-like appearance. The upper two nasal conchae compose the processes of the ethmoid bone. The vomer is a thin plate of bone situated in the MSP at the floor of the nasal cavity. It forms the inferior nasal septum, and the superior border articulates with the body of the sphenoid bone. The superior part of the anterior border articulates with perpendicular plate of the ethmoid bone, and the posterior border is free. The mandible is the largest and densest bone of the face. The body is the curved horizontal portion, and the rami are the two vertical portions on each side of the body. The angle of the mandible, also called the gonion, makes up the junction of the body and the ramus. The mental protuberance is the anterior triangular prominence, and the symphysis is the most anterior and central part where the left and right halves of the mandible fuse. The alveolar process is on the superior border of the body and consists of spongy bone that supports the roots of the teeth. The mental foramina are small openings on each side below the second premolar, which transmit nerves and blood vessels. The mandible has a coronoid process, which is an anterior process on the top of the ramus. The condylar process is a posterior process on top of the ramus, which articulates with the mandibular fossa of the temporal bone to form the temporomandibular joint, or TMJ. The mandibular notch is the concave area at the top of the ramus between the coronoid and condylar processes. The hyoid bone is a small U-shaped bone situated at the base of the tongue and acts as an accessory bone of the axial skeleton. But it's not considered a facial or cranial bone. It's the only bone in the body that does not articulate with another bone. Each orbit is composed of 7 bones: frontal, sphenoid, ethmoid, maxilla, zygoma, lacrimal, and palatine. You should also be able to name the openings in the orbital cavity shown here: the optic foramen, superior orbital fissure, and the inferior orbital fissure.